This is an instructional video for the Barrier EasyWarm and EasyWarm Plus active warming blankets. The EasyWarm blanket is a non-sterile single-use patient warming device. Each blanket is vacuum sealed individually and comes packaged with instructions for use. Perioperative use of Barrier EasyWarm active self-warming blankets help to reduce pre-operative, intraoperative and post-operative hypothermia. Unlike passive warming, which reduces heat loss without applying external heat to the body, active warming transfers heat to the body using an external source of heat. EasyWarm is an ideal product to provide an active pre-warming solution for your patients, allowing you to work within National Institute of Care Excellence guidelines on pre-warming without the need for additional equipment like forced air warming, and providing a versatile, noiseless, user-friendly solution. In this video, I will be demonstrating the instructions for use, contraindications and best practice for the use of EasyWarm and EasyWarm Plus blankets. In order to activate the blanket, simply open the vacuum pack along the pre-cut tab, open and unfold the blanket completely. The blanket reaches an operational temperature in approximately 30 minutes and maintains its temperature for up to 10 hours. Therefore, when warming is required to start at a certain time, it is ideal to open the blanket early to allow it to reach temperature. Heat is generated through an exothermic reaction when the warming pads containing iron powder, active charcoal, water and sodium acrylate react with the air. Once at temperature, the blanket maintains an average temperature of 44 degrees Celsius. The skin temperature under each warmer reaches a maximum of 42 degrees Celsius. This temperature means that the Barrier EasyWarm blanket is as effective as forced air warming in maintaining core body temperature greater than or equal to 36 degrees Celsius. And when used pre-operatively, a typical drop of 1 to 1.5 degrees Celsius on induction of anaesthesia does not occur. Studies have shown that the average drop is less or equal to 0.6 degrees Celsius in core body temperature when using an EasyWarm blanket. When placing the blanket on the patient, ensure that the warming pads are facing up. This is indicated by the "this side up" marking on the blanket. The blanket should not be placed over the patient's face. The blanket should not be tucked under the patient's arms, legs or body, and should not be placed under the patient. The anaesthetised patient's hands, arms and limbs should not be placed on top of the blanket. Fixation belts, tape, straps or supplemental bedding should not be used on top of the blanket. No extra weight or pressure should be placed on top of the blanket, such as medical instruments and other weight-bearing objects. Cutaneous response should be monitored regularly according to clinical judgment to check for any adverse patient-specific reactions. When accessing the patient, the blanket should be turned or slid. It should not be folded over on itself. Do not use Barrier EasyWarm blankets on a patient with known hypersensitivity to the materials of the product. It is recommended to avoid direct skin contact in areas with bruising, swelling and frostbite. The warming pads are magnetic and not translucent. The blanket must be removed prior to images being taken by MRI or X-ray devices. Heat generated from the blanket may result in increased drug delivery from transdermal medication systems such as opioid patches. Do not reuse this product. If reused, performance of the product may deteriorate and cross-contamination may occur. There are a variety of ways to place the EasyWarm and EasyWarm Plus blankets to enable patient access and comfort. Both the standard and Plus blankets can be used on awake and anaesthetised patients. The standard EasyWarm is a one-piece blanket that can provide active warming in a number of situations. The EasyWarm Plus is a two-piece blanket. It can be used joined to cover a larger patient area or split to enable more versatile patient coverage. When a patient is mobile and walking whilst using EasyWarm, it is important to ensure that the blanket is held in place by one hand, leaving the patient's other hand free for stability and support if needed. After use, EasyWarm blankets can be disposed of as regular hospital waste or in accordance with local protocol. Mölnlycke can provide training sessions around perioperative hypothermia to our customers, supporting them understanding the further issues around this subject, giving an overview of the importance of maintaining normothermia in surgical patients and prevention of perioperative hypothermia. For more information on the EasyWarm range, please visit the Mölnlycke website.